Well, hello, everybody. I'm Deidre Malone, president of the National Women's Political Caucus, and I want to thank everybody for tuning in for this vital conversation with the Congresswoman Jill Tokuda. I'm gonna get it right, Congresswoman. And so we're going to be talking today about the big ugly bill and access to health care. And we're so thrilled that the Congresswoman is joining us for this conversation today. And I just want to acknowledge one of our members who is in Hawaii, Cindy Carpenter, who's been working really hard to try and organize our National Women's Political Caucus in Hawaii. We're getting ready to gear that back up and so excited about it. So Cindy, thank you so much for your hard work. And I also want to thank Brittany Ross, who works with the Congresswoman. She's amazing. She has really helped us coordinate that. And I wanted to give a shout out to her. At this time, without further ado, I'd like to introduce our Vice President of Membership for the West, Bland, who is going to introduce our Congresswoman. Char.
Thank you, our President Deidre Malone. I appreciate that introduction, and it looks like we have a number of people who have attended today. And just so that they know, and we just kind of put a scope around this, we're probably going to go for about an hour, maybe a little bit less, but up to an hour. So we're so happy that you joined, and I'm excited to it's my great honor actually to introduce Congresswoman Jill Tokuda.
Tokuda.
And an unwavering advocate for access to healthcare, equity and education, and economic resilience in Hawaii. You know, her dedication to public service reflects a blend of visionary leadership and deep-rooted compassion for our communities. And during her time in Hawaii State Senate, Congresswoman Tokuda chaired key committees including Ways and Means, Education and Higher Education, Agriculture, and Hawaiian Affairs and Labor. And as chair of the influential Ways and Means Committee, she oversaw the state's 14 billion, that's a B, not an M, a billion budget and shepherded crucial fiscal and tax legislation. Her legacy includes championing the state's first executive office on early learning and the Hawaii Kiki, the state's first executive office on early learning and programs, initiatives that brought vital health services directly into our public schools. She also led the passage of enabling legislation to protect important agricultural lands, fulfilling a 30-year constitutional mandate that now secures Hawaii's most productive food sources for generations to come. But beyond elected office, her work spans public, private, and nonprofit sectors. As a co-director of Cyber Hawaii, she supported workforce development initiatives at the Nisi Veterans Memorial Center. She raised funds to expand the cherished facility in Maui. Her leadership extends to the boards of Hawaii Data Collaborative and the Hawaii Budget and Policy Center, and she is a founding member of the Patsy T. Mink PAC, which champions pro-choice women candidates. Perfect, because it aligns with NWPC. And during the pandemic, she was appointed to the White House Select Committee on COVID-19 economic and financial preparedness, helping to monitor over 21 billion in federal relief and ensuring it reached the communities and programs that needed it most. So tonight, as she speaks on that big ugly bill, access to health care, we are reminded that true progress relies on voices like hers, voices that illuminate policy with lived experience, integrity, and bold advocacy. So please welcome us all in joining Congresswoman Jill Tokuda. And I'm going to move to Hawaii just so I can pronounce your name correctly.
Thank you,
Thank you.
Shar. And just Jill works absolutely fine.
Okay.
Please. In most corners of this state, I'm Auntie Jill.
Oh,
As Cindy
wow.
well
Okay.
knows, when you've reached auntie status, that is like the highlight of life. So,
And we have an
but
auntie here in California, and you probably know who she is.
yes. Yes, you know, quite frankly, if I could have the aunties caucus in Congress, I absolutely would. And that would be the real kick-ass caucus, if you ask me. But really excited to have people on this call right now. Really excited about the potential to organize in Hawaii. If we have ever seen a moment in our history when we need to band together and stand up for what is most important, not just to ourselves, but especially to our daughters, our nieces, our granddaughters, every generation that will come after us. It's so important that we stick together. And I'd love for this to be as informal a conversation as possible. I'm not sure if people can stick in questions or
I
can
can't.
unmute or talk. That would be the best thing. But let's just be real about the big ugly bill. And I've called it many different words. There's nothing beautiful about it, first of all. Really, this is all just, a big bailout for billionaires. That's really all this is. And sadly, it's a big bailout for billionaires that absolutely undermines and destroys our social safety net. And the worst thing about this bill, it's a bill that is being charged to our children. They're going to have to pay the bill, right? When you think about the deficits that this leaves us with, $5 trillion, depending on how you calculate, it's at least $5 trillion that ultimately will be borne by our kids and grandkids. And so that is adding insult to injury, total salt in the wound. And for myself, one of the first things I did in Congress was I co-founded and I co-lead the bipartisan rural health caucus in Congress because, where I live in Hawaii, even the urban parts are remote, right? We are rural and remote. In many cases, certain kind of care that you need, you've got to get onto a plane. Even just to be able to have a baby, you can't have them on all of our islands, and they don't. Lanai, for example, you can count on one hand the number of live births that they have on island, which means the mommy needs to get on a plane if she's able to, because by the way, that transportation is not guaranteed, and get to Maui or another island, the island of Oahu, to be able to give birth. And, it is expensive. And so we have heard sad stories of young new mothers coming back with literally infants, newborns, on a Cessna plane by themselves because they couldn't afford to have, their partner, their mother, their father, anyone there with them because of the cost. In many cases, sometimes the shortest distances are the most expensive in our state. And I represent all those rural parts, every single island in the chain. And I think Cindy can understand that and relate to that too. There are huge disparities that exist even within our islands of Hawaii. And CD2 represents all of our islands. And that's my beautiful district. But because of those disparities and the limitations on access to health, rural health means even more to me. And so when you take a look at what the big ugly bill did, $1 trillion in cuts to Medicaid, right? And we call it Aloha Care or MedQuest in Hawaii. $500 billion, $500 billion in cuts to Medicare, you know, hundreds of billions of dollars in cuts to SNAP, food money, and food is medicine. So I don't separate that out when I talk about health. When we take a look at many of our hospitals, rural hospitals, especially our federally qualified health centers, providers that are in rural communities, they have told me point blank, they will not make the year. If these kinds of cuts come through, and if they're the majority of their clients are on Medicaid and they're going to see reductions in their reimbursements, hospital doors will close. And so getting even the most basic or emergency care that you need will not be provided. The slap in the face to Planned Parenthood, not even allowing them to provide preventative care, primary care to our women and girls. Again, insult on injury. We're not talking about abortion care. We're talking about your mammograms, your health screenings, your cancer screenings. This is stuff that keeps people alive. Taking that away from them, making them ineligible for Medicaid. And I know the courts have done a reverse on that, but they are constantly coming for us women. Let's be really real here. They are constantly undermining the rights we have fought for, the rights, quite frankly, we shouldn't even have to fight for when we're talking about access to the most basic health care and mental health services. And so those are just a few of the things. I mean, nobody wants to go through all 1,000 pages of what that big ugly bill has done, especially to healthcare. But you want to talk about jobs lost in the energy and tech sector? Yeah, hundreds of thousands of those gone. You want to talk about Pell Grants and student loans? That's going to be millions of students will be impacted. For many who were looking to be doctors, professionals in the field. If you know how much it costs, what they've done to it has put now those jobs, those opportunities to take care of their community, it's taken them away from a lot of students right now that are scared. I'm not sure how to move forward. This has really been devastating. And I know we're talking about health, but really every possible thing we need to stay healthy and to stay well, even the basic research to try to go after those things that harm us, cancer research and all these other types of things, completely gone. You look at other things that they've been doing in addition to the big ugly bill, removing regulations and regulators and different things at the EPA. Again, if you take a look at what has been their guardrails, safety nets to keep us safe, they've come and attacked that. So it's it's a pretty grim landscape right now. But if there is one thing that gives me hope, it's a room full of strong manawahine, that's strong, powerful women that are willing to come together and stand up and fight for the most basic of our rights, but especially to fight for the next generation. That we leave it better for them. And right now, when I look at my nieces, they've got less rights than their grandmothers. And that's not right either. And so I am, just feel so hopeful and blessed that Hawaii can create a strong NWPC presence here in our state and add to the national voices when it comes to defending our rights and making sure that we are heard. So, with that, I would love to, I'm not sure what the format is to keep
Sure.
this conversation going and keep it very informal, but just so excited by the opportunity for us to have a strong presence here in Hawaii.
So Jill, quick question in terms of rural healthcare. Do you
Mhm.
think this big ugly bill will have an effect on maybe closing some of the healthcare facilities in Hawaii? I know I live in Tennessee, and
Mhm.
so we've already been closing, hospitals in rural areas. So what type of effect do you think it's going to have on Hawaii?
Nobody wants to see a hospital close. We don't even have enough, right? Quite
Yeah.
frankly, we need more. It's about adding, not subtracting. Um, but if it's as bad as we think it could be, we will see hospitals close. There's estimates that at least six of our rural hospitals, and that's are on the neighbor island, but we could see some on Oahu as well, the main island, they will shut down. And if you ask people, how long does it take you to even get a appointment, right, with a primary care physician or a specialist, it can take you to weeks to months. And it's going to only get worse if you lose a hospital. And if that hospital that closes is the only one on island, let's say, then you're going to be even more limited and have to leave the island to get care that you need. And so, um, you know, we hate to scare people, but the reality is these hospitals barely are making it as it is right now. They're on very thin margins. They don't have lots of cash reserves to hold on to, and so they're going to do everything they can. What you'll probably see first is a reduction in certain services. Maybe they can't have the same hours that they do. Maybe they let go some specialists. They might let go. Sadly, one of the first things we've seen let go is the OBGYN services,
Mm,
right? And we need more of that when you take a look
yes.
at our maternal, um, you know, mortality and morbidity rates across the country, especially in rural communities. But that tends to be one of the first things after the ER that they start to close down. And then you get that slow progression or fast to the doors completely shutting. And so we have to make sure people understand why this is happening. I saw a news article where at least one hospital's already closed, and they said this has nothing to do with Trump and this has nothing to do with the big ugly bill. And I'm sorry. It
Yeah.
100% does. Let's be absolutely honest with ourselves. And I know Tennessee, you all got a lot of vulnerable health centers out there too, as well. So
We
yeah.
absolutely do. And we want to invite our attendees, make sure you ask questions in the Q&A. Our Congresswoman is here and she'll be able to answer those questions for you. And Cindy, there was a question in there for you. Somebody wants to know how to get in contact with you.
Oh, okay.
Um, And so, Jill, also around SNAP benefits, it's my understanding, and you tell me, have they changed the criteria for individuals who are recipients of those benefits in this big
They have
ugly
definitely
bill?
that big ugly bill has changed a lot of the requirements. You know, they focus a lot on ABODs, right? We hear that, and I feel like it is such a dehumanizing termination, able-bodied individuals. And so they have, you know, reduced some of the exemptions that are out there. I was just, you know, every day you realize something worse of what was in there. Um, Survivors of domestic violence are no longer exempt from those kind of work requirements. I'm sorry. Why don't you go experience something like that yourselves and tell me that you feel completely capable and able of going into a work environment, not even knowing what your situation might have been, not even understanding the trauma that you have gone through, but basically saying for you and your family to get the basic food you need, go work. That's really the inhumanity they were talking about. The fact that we were even debating in Congress how old our kids should be before the work requirements should catch in. And, you know, you might have heard some of those where they're saying, well, up until 7 years old. I'm like, so what magically happens at 8 years old that makes it okay for mom to have to go? And this is usually often, we know, single mothers that are going to be most at risk for losing benefits. I have two teenage boys. Last I checked, nothing magical happened between the age of 7 and 8. And now they've increased that, I think, to 13 or 14. The teenagers eat more. I don't know if
They do.
these guys have ever gone to a grocery store. And I will tell you that in Hawaii in particular, our groceries are typically twice as much, if not more, than a lot of parts of this
Yeah.
country. You know, we're talking about on average $6 a day. SNAP is supplemental. It was, yes, you know, Republicans keep saying it was never meant to cover the whole meal. Well, I promise you, it does not cover the whole meal where we're from here in Hawaii. And so, you know, all of these different things, increasing the age to 64, all of these different things will just make it so much more difficult. Their goal is to make people ineligible, right? Disenrollment sadly saves them money that goes towards their billionaire tax credits.
Yeah.
That is the game here. But we all know that that ineligibility means people don't eat. People don't get the food that they need. Grocery stores even suffer because people can't shop at these small mom and pop stores that provide these food services in what are food deserts throughout our islands and throughout the country. Farmers lose out on the ability to be able to have people purchase their products, right? There's such a huge, it's a tsunami effect. It's not a ripple effect, it's a
It really,
tsunami
yes,
effect if we
yes,
think about it. This is going to hurt
yes,
people with big
yes,
waves of
yes,
pain.
yes.
And that is something that has to be made really, really clear. Yeah.
Well,
Yeah.
and Char and Cindy, don't let me ask all the questions.
No,
So
no,
if
no.
you
I
have,
do.
well,
I have a couple
Yes,
questions. I would like.
I do have a question because when I think about what's happening here and the racial injustice that's happening behind all this, we have to bring that forward in the
Yeah,
conversation because it's
absolutely.
appears to be very targeted. And so, because when you're talking about healthcare, talk the food insecurities, you're talking about if you're talking about those things that are unstable, you're looking at people who are going to do unstable jobs, right?
Hmm.
Because they're not
Hmm.
going to be able to get the jobs that they need to do that would offer all the benefits. And when I look at this, when I look at this whole thing and I think about, how you number one came out the gate and just did DEI, right? We
yeah,
just took that
Hmm.
right off the table, and we know that for a population of people of color, getting through that door and that opportunity to get through that door was all we had.
yeah,
And
Yeah.
so, and I say it like that because you could be the most educated, but because of what we live with, taking that away is a really big deal. And then you talk
Yeah.
about then you talk about taking away education, right?
Yeah.
Education. If you can't educate people, then you can't stabilize people. right?
Hmm.
You have to educate them so they can get empowered to get a decent job to be able to support their families. And then you turn around and you do all these things, and now you say, well, I'm going to take the food programs out of the school. And that's just not for the people who are low income. I know people who have a very good income, but they
Yeah.
have to be at work at 8 o'clock, and being able to get
Hmm.
their child that breakfast at 7:15 because they need to get to work at 8 really help them. And so
Yes.
it's this huge, like you said, tsunami effect that's going to be higher poverty, worse health outcomes, and deeper hardships. And it goes
Yeah.
back to something you said, Congresswoman Jill. You know, domestic violence is huge because
Yeah.
if you have all these things happening in your household, then
Hmm.
that becomes a very, very at-risk situation for
Absolutely.
the partners. And so it is a tsunami effect. And I think that we have to look at
Hmm.
holistically at really what's happening here. And when I look at the islands of Hawaii and what you said, I didn't know that women had to get on a plane to go to a place to give birth, because there's no local hospital or care place to do that. That's huge. We should be
Yeah.
pouring our money into these rural areas. But you know what? When I think about Hawaii and I think about Tennessee and Alabama and
Yeah.
Kentucky and all these
Hmm.
places, those
Yep.
rural areas are touched as well. We don't feel that so much on the West Coast, right? But that's a great point to bring that up.
And
So
Char,
I see there's questions in there as well. Shall I announce those questions, President
sure.
Deidre?
Go ahead, Char. That'll be
Okay.
fine.
Okay, so I'm sorry, I just had to get that out, Congressman Jill. I'm very little passionate about this. It's like it's horrible and it's holistic that's
It
happening here.
is.
So
Absolutely.
and I love that you said tsunami because it is a tsunami.
Well, you know what? People can understand that right now. Absolutely.
All
It's that.
right.
Okay, so I'm going to start with the first question here, and we're doing pretty good on time. We're doing really good on time. We have another 30 minutes, so we can kind of relax through this a little bit. So we have a question in here that's asked the question, since most of these changes to Medicare take place after the midterms, if the
Hmm.
Dems regain control, what are the pathways to repeal these changes before they take effect? What a great question.
That's great. I'm trying not to close out any screens. I'm technically challenged, but I think this is coming from Heather Kimball.
It
Is
It
that
is.
is.
correct?
It
City
is.
Councilwoman.
Yes.
It
Yes.
is.
All right. She's an amazing advocate, super duper mom, council member, I believe council chair right now. So we're very proud of her. Um, First of all, that's a great point, Heather. We have to let people know that while you may not feel that disenrollment today, it is coming, right? Because we do want to make sure that people are held accountable come the midterms. Even if you don't see changes immediately to your Medicaid or your SNAP, um, don't think you're fine. That's always the fear, right? That people will somehow think that they're okay and they don't have to, let their members of Congress know, hey, there needs to be accountability for what you did to me and to my family and to the people that I love. Now, I am a very optimistic, hopeful person. And quite frankly, we have to do everything we can to flip that majority come 2026. We need to have some kind of wall, some kind of sanity check, whatever it is. We need to take back the House. I think right now, quite frankly, Dems need to start putting together a list. What's the top 10 things we are immediately going to do once we get into office? Now we know we're still going to have that president and his executive office and that crazy pen of his and going after it. But what will we do? Right? What is the first priority in terms of making sure from a Maslow's hierarchy, right? The health and safety of people, being able to feed yourself, all of these very basic things. What are we going to look to repeal and reverse? What are we going to take back control over? Because we're every day, that's all we see in Congress. We're abdicating our responsibility of the power of the purse. That should never be happening. These rescission bills that you're seeing, where bipartisan decisions to fund things like public television, like radio communications, like foreign aid that literally saves millions of lives, right? What we're rescinding that. We need to take back that purse. We need to grab that purse back from the president. We need to make sure that we're in control again. And so I do think that Democrats need to come up with their top 10 list. We need to come up with our top 10. What's the first thing we're going to do? Not that we're even going to wait that long. Honestly, I think we should be putting discharge petitions up every single week where we all sign and we wait for four, courageous Republicans to put their name on there too, so that we can start actually taking hard votes and making them say no to things like health care for kids or food money for kupuna and their senior citizens and all of these different types of things. So we won't wait, but we need to, if you ask me, when we get back from our summer recess, we need to be way more aggressive based upon what we've been seeing. So,
and Congresswoman Jill, to your point, this big ugly bill did not come over the last 6 months. They took 4 years to prepare this. And I love what you said, because the Dems need to take less than 4 years to do what you just said, those top 10 points, because we can't wait till the end of this, because they didn't wait till the end. They had this mapped out. And I remember our Vice President Kamala saying that this was coming, and she knew all about it, and she was telling people about it way before it happened, and they denied that that even existed. Remember that? They said, oh, no, that doesn't exist. That doesn't exist. But they knew it was, because they collectively did this over the last 4 years. They were ready to just pull the trigger as soon as they got in. So, okay, let's go on to the next question. Thank you so much. Okay, so Leland Brady is asking you, Representative Jill, thank you so much for your continued advocacy. One thing that I think a lot of people forget to consider is that this also affects home and community-based services, which are supposed to help provide support in the home rather than having it be institutionalized. For those HCBSs that are already in a deficit to help due to lack of resources, what are some of your suggestions to combat this?
I'm going to answer that, but Cindy, did you have your hand up? I
wanted to comment on what Char was saying about especially how this is impacting the marginalized communities, and how I read somewhere recently that Hawaii residents, something like 40,000 will be impacted immediately, and with Medicaid and SNAP. So my question is, how are you coordinating with other stakeholders, local, county, or I'm sorry, state, organizations, to see how we can, take care of some of these needs that maybe have been cut?
Yeah, no, we actually were supposed to hold a press conference and protest rally. I have my protest shirt somewhere on my desk over here, on the 60th anniversary of Medicaid and Medicare on Wednesday. So it got canceled because of the tsunami the day before. We will hold it again, but just to give you some perspective, 400,000 people in Hawaii rely on Medicaid. That is like the entire Big Island. That is the Hawaii Island, all of that. It's entire island of Maui, Molokai, and Lanai, and then some, and then some. The whole island, the entire population we're talking about. When you think about 400,000 people in Hawaii that rely on Medicaid, and the fact that across the United States, half of the recipients of Medicaid are children. Children, right? Children are the ones that are covered by Medicaid. And then kind of to the point that was just raised by Leland, when we talk about long-term care for kupuna, for senior citizens, making sure that they can, have some kind of long-term care, living situation, housing, it is through Medicaid. So when you cut Medicaid, you are cutting all of these home and community-based services. On top of all of that, even if you want to stay on the seniors, a lot of, the ACL funding and other things are also in jeopardy right now. The president, I believe, in his skinny bill, his skinny budget that he passed out, he line itemed so many different things out, which included a lot of those respite care, chore services, transportation services, meal services for seniors that allow them to live independent lives. Right. And so this really is, I think, we brought it up a little earlier, decimated our ability to really, everyone wants to be working, living in their own home, right? Having a thriving family, a good quality of life. This is the American dream. What they're doing is they're cutting off every possible opportunity, every support network that can help you live that American dream, whether it's your health care, whether it's that little bit of food money that helps you, be able to feed your children, whether it is educational opportunities through Pell Grants, whether it is home and community-based services and care so that you can live with dignity in your own home. That was always the medical home model that we were moving towards. Let's not keep people in institutions. Let's not keep people in hospitals. Let them, live with dignity in their homes and provide those services that often come through Medicaid. These are the ones that will be cut, that long-term care funding. And I don't think people realize that yet. And so one of the things that we have been doing, we would have done on Wednesday had we had the press conference, right? And I've been doing in Congress all the time is I share stories. I share real stories from real people in terms of what Medicaid has meant to them, how it has given them hope. It's been life-saving to their family to get cancer treatment, what it would mean if they would lose it. I had a woman write a story to me where she talked about selling her wedding rings in order to put food on the table while her husband went through cancer care. I mean, this is real life, right? And we need them to understand making cuts to Medicaid and to SNAP and to Medicare. This is not about going after lazy 29-year-olds on their mother's couch playing video games, which is what they always talk about. These are real people. Majority of them are working adults trying to hold together families. These are the ones that are going to be the victims as a result of all of these cuts. So the more we can put a human face, a human situation, a human story that hopefully we can get more Republicans and other people across this country to relate to and understand this is why we're fighting against these cuts and to change their mind, to change their heart, right? That is what we have to do. And so, especially when it comes to home and community-based services, the more you can share your stories with me about what this could mean in real life to real people, I will keep taking my stories to the floor and in my speeches and wherever they'll listen to me so that they understand that this is not just me speaking. These are families. These are real people. So thank you for that question. But that is one thing I'm truly worried about. And that's why the state and the county and the feds, we're all sitting together and the nonprofit sector to talk about where we're going to be able to bridge. But the hard part is no matter what state you're in, Tennessee, Alabama, Kentucky, Hawaii, California, the cuts are all over the place. So which one will you save at what expense, right? So if we try to bridge the Medicaid cuts, can we afford the SNAP cuts and try to, fill in the food money? At the same time, he wants to rip away 21st century funding or Title I funding from schools. Can we help the schools? And I'm a proud public graduate and my babies go to the same public schools that my husband and I went to. We may not, states won't be able to bridge it all. And so that's why we're having some tough conversations about how we protect and bridge as much as we can. The most important thing, though, is Congress needs to put a stop to this nonsense. That's just the most important thing we need to focus on.
Yeah. Thank you so much. Okay, I'm going to go on to the next question, which is from Judith Mills. And can you explain why your Republican females colleagues don't share your concern for women's issues?
Excellent
I
question.
know we all have uteruses. I don't understand. You should be worried about it. Right? It's hard. I mean, you look at them and you take a vote on these bills, supporting access to reproductive health care and abortion is health care, right? All of these things, and they vote against it. It really boggles the mind, especially since in many cases, for some of these women in Congress, you have heard them say the opposite out in the street in their district. Sometimes they will actually say, oh no, I support reproductive health care and all this, and then boom, you vote against all of this.
Yeah.
So I think this is where people need to hold them accountable. And maybe they just need an education on their bodies as well. I've talked, they not only have they gone against abortion, they've even attacked things like birth control.
Yeah.
And I've told people, as somebody who suffers dearly from adenomyosis and polycystic ovarian syndrome and way too many other things, if it wasn't for an IUD or birth control, I could not live. It would be
Oh.
unbearable,
Mhm.
absolutely unbearable. Try living with my uterus on a bad day. Most men
Yeah.
couldn't handle it, right? I mean, that's the bottom line. So they need to understand that we're talking about the most basic health care for our bodies, for what we need to exist. And so perhaps they need a little education. Perhaps they don't know, why this is so important. But the fact that you can even have members that will say that, these restrictions in their state are fine because don't worry, if you're really in a life-threatening situation, you'll get taken care of. Sadly, we know that's a very privileged statement to be making in many
Yes.
cases. They
Mm.
are members of Congress. They will be treated very differently. We all know that on this call than any other woman who happens to show up, and God forbid she be a woman of color.
Yes.
That is the bottom line. Many of these women, many of these members come from a very privileged perspective,
Mhm.
whether it's
Mhm.
talking about access to healthcare, whether it's talking about education. The fact, as Deidre mentioned, they went after DEI first. Again, that is a very privileged position in which to speak, saying that color shouldn't matter, because it never mattered to many of them, ever.
Right.
Mhm.
And I think the
Yeah.
same goes with some of these healthcare. For many of them, I mean, I'm not saying a majority of the female members of Congress, Republican, or, you know, Caucasian, but they probably are. So it's a very privileged position versus Sally, where we know you lack the access. It has been very difficult. It has been extremely difficult. And again, even just thinking of keeping our women alive, the
Mm.
maternal morbidity and mortality rates for women
Oh.
of color. Native
It's
Hawaiians
very high.
actually were smaller in Native Hawaiians, but our mortality rates were far higher than many other
Mm.
demographics, many
Mm.
because of the access to care. A lot of it comes down to just basic access to healthcare and awareness and so many other things. So we will keep pushing that some of these women will join us in the fight. But oddly, sometimes we find it's almost easier to try to pull away one of the men, which is
Okay.
Mm.
mind-boggling. But
Yeah.
um, either which way we will pull them away, we have to. Just four brave souls. That's all. Four. Yes.
Okay. Thank you. Okay. There has been some work in recent years to expand midwife and doula services for
Mm,
prenatal labor and delivery and postnatal care. These can be community based and help fill gaps and provided needed care in uncomplicated pregnancies and births. Does Hawaii have a network of that kind of provider, and are they often reimbursed from Medicaid as well? Meaning, will the bill hurt those services as well? And that is uniquely woman friendly healthcare, but it can't be provided for free. And this question comes from Karen Humphrey.
hmm No, that's a great question. And we have been focused on the midwifery issue for some time in Hawaii. It's been quite controversial. I can't say that we've actually really figured that out yet. But, for me, when I look at my district, again, I have every island. And as I've mentioned, in some cases, you really can't give birth. Like Lanai is the particular island in question, right? You really can't
Mm.
give birth. They don't want you to. If you happen to, you do. But there really aren't the facilities and supports to be able to do it safely on island. Midwives are, in many cases, the option to be able to provide women with that pre and postnatal care that they need in their communities. In many ways, culturally appropriate and sensitive as well. So that is something to me that has to be part of the discussion overall, whether you're in Hawaii or anywhere else in the country, in terms of providing that additional level of support. I believe I'd have to go look back at the Hawaii legislation, but there is certified professional midwife kind of, status, and that is nationally recognized. That could be one, thing that could be recognized in terms of, being able to provide that care. I would honestly have to check in terms of the different types of reimbursement that would be eligible from Medicaid as well. Bottom line, all these cuts are hurting us all over the place. But again, in my humble opinion, midwives and doulas have to be part of the equation in terms of accessing pre and post. Post is really important too. Natal care, because especially when you think about folks going back to their homes in rural and remote communities, oftentimes getting to a doctor may not be possible. Telehealth isn't always the best option. And if you want culturally sensitive, care, and that kind of services, oftentimes midwives and doulas are the ones that can best support those efforts. And so I fully support them in having a pathway to be able to provide those access points throughout our islands and our community.
Okay, thank you. And also I want to go back to a comment that Heather just says, mahalo for the great response, Congresswoman, and amen. So, okay, the next question is from Julie. Training the upcoming workforce for the healthcare industry is also key. Representative Tokuda has been a champion of the Job Corps program that
Yeah.
trains young women and men in health care careers such as certified nurse assistants, pharmacy technicians, and behavioral health specialists. So mahalo to you, Congresswoman Jill. And then I'm just going to jump to this last question here. Because it comes from Leland again, and she talks about this affects so many people across age demographics, Kapuna, people with disabilities that rely on Medicare and Medicaid for these supports, and Kiki with food insecurities, etc. Do you know if the state of Hawaii has any plan on financially supplementing any of these funds that will be cut at the federal level?
Great question.
That's a great question. So I believe they've got pots of money that have been set aside, right? As a result of the last legislative session that they have. They do have a rainy day fund. So they've got some money in there. The question is, will it be enough? If you put away $200 million, it seems like a lot. How far will that stretch? Again, as I mentioned, you're not going to be able to make everything whole, just given the level of cuts that we are seeing. And so it will be about hopefully quickly understanding what the impacts will be to the state. And then being able to decide, okay, how much should we pull from that fund? I think they put aside $200 million, but there was more in the rainy day fund that they have. There are other options too, having balanced the state budget before. There are other options, like extending out your OPEB responsibilities, paying off pensions and whatnot. Doesn't do good things for your credit record as a state. It's just like, adding a longer payment plan to your credit card. But there are ways that the state could give itself a few $100 million more of cash each year if it was required, right? And so these are the hard, tough decisions. Hopefully we never have to make, but our options, again, if it means that Keiki and Kapuna, persons with disabilities, can have health care, we can keep rural hospitals open. As you know, too, and this is what I worry about, right? These are smoke and mirrors kind of tactics. But the Republicans established, I think it was a $50 billion pot of money for rural hospitals to try to keep them open. Well, no offense, that's a pittance compared to what damage they have done. 3 times over easily in terms of the amount of money they took away from rural hospitals in Medicaid and Medicare reimbursements. So that $50 billion pot they dangled out there, which we still don't know how it will be distributed really, and could be inequitably distributed to Republican states in many cases, right? Again, that still won't be enough. I'm sure people are licking their chops thinking, oh, good, we'll get some money, we'll be fine. But let's think of the long term here, people. Will you be able to sustain yourself beyond that initial pot of money, given that they're giving you 50 billion, but they've taken over 150 billion likely in your reimbursements? So, it's not easy math, but I think this is where the state, the federal, the county, all of us have to sit down, philanthropy even, and talk about how we bridge different gaps. Who's going to help take care of some of the food money, and the farmers, and making sure kids have school lunches, and, there's still food baskets available for people to supplement what they don't have on SNAP. Who's going to take care of the Medicare and the Medicaid? Who's going to take care of different, education and public schools? And I think this is where we're going to have to be really creative. But it won't be easy. It won't be easy. So.
Okay.
Yes.
Congresswoman, this has been amazing. We appreciate you so much, Congresswoman Jill, and thank you for all the hard work you're doing in Washington, D.C. on our behalf and the citizens of Hawaii. And so at this time, I know Cindy has some comments, and then Char will wrap it up. But thank you, Congresswoman. We appreciate you so much.
Thank you.
And please stay with us, Congresswoman Jill.
Yes, thank you, Congresswoman Jill. Aloha, everybody, and thank you for joining us today. I've been a proud member of NWPC for over 15 years now, and I recently relocated to Hawaii, and I realized that there's a definite need for an organization like NWPC with the strong community and sisterhood that they have here, that we could really use some support, I think, to get some strong women in leadership positions like our Congresswoman Tokuda. And I've been speaking to different agencies, including I just went and had a meeting with the political science department at the University of Hawaii. They're pretty much shut down for the summer, but in the fall, I think we're gonna maybe do a presentation there and see what we can do to get some young women to, think about leadership roles in the future, and maybe do some mentorship, things like that. As well as I'm looking at some senior centers and some other organizations around. I've been speaking to see what we can do to start a, NWPC Hawaii. So we're pretty close. So hopefully in the next week or two, we should be able to get one going. And anybody here who has any ideas or would like to contact me, please do so. And maybe we can put our heads together and put our efforts together and help support your, since the tsunami took, I guess your protest, was delayed, right? Well, maybe we'll put our efforts together so we can kind of make some changes.
Perfect. Thank you so much, Cindy, and for mentioning that, because we have several people that are attending today, and I just want to just kind of give just a brief little history about NWPC, in that they were founded in 1971 by these strong, prominent women: Gloria Steinem, Shirley Chisholm, Betty Friedan, Fannie Lou Hamer, Bella Abzug. These are people that were just got in a room and said, you know what, we're going to make a difference. And about 300 of their closest friends from across the country. And NWC is the only national organization exclusively dedicated to increasing women's participation in all political and public life. We have elected and appointed officials, delegates to national party conventions, judges in federal and state courts, lobbyists, voters, campaign organizers, and with state and local facilities across the country. So we really want to invite those who are participating today. If you're not a member, please be a member to the National Women's Political Caucus. You can just go to nwpc.org. .org, and what you want to do is it'll say there's a lineup there says take action. Hit take action, then go down and says become a member. And under become a member, if you don't see, which you won't see your state in there's a little place in there that says if you don't see your state, click here. Click here, and for a mere $40, you get to sign up and be part of this powerful organization that we are, we're electing women to office. That's what we're about. We recruit, we train, and we get women elected to office, and we get behind them through endorsements. That's really important because, as you know, Congresswoman Jill, we don't want to say this, but it takes money to win.
Yeah.
It just takes money to win. It really does. And so with that, I just want to thank everyone for attending today. And if any attendees, again, in the chat, any questions, go to nwpc.org and be sure and sign up to be a member of NWPC. And thank you for your time this evening. We know it's late for some and it's early for some. The sun's about to set there, and when I'm in Hawaii, I stay until that sun sets on the beach. So we're hoping to see you soon, Congresswoman Jill. And so thank you
Absolutely.
again for just being a part of our organization. We really appreciate it.
So appreciate you. Everybody have a great night. Congresswoman, thank you so much again.